had chronic pain pretty much most of my life. I've been through every type of physical therapy to acupuncture. My kidney function was starting to decrease, and the doctor said, you got to come off all the pain medicine.
I had just finished an exam with my doctor. I was on Oxycontin, and he said the pain medicine was wearing, and he said my next step was, help me out there. Morphine. And morphine, the idea of morphine really just scared the dickens out of me. I came in with an open mind. I wanted off of meds so bad.
I have cluster headaches and fibromyalgia, and I tried every medication and was allergic to it or couldn't stand the side effects. I wanted to live life again because I was living life on my couch or in my bed.
This is the very last day of ours. I've been here 20 days as of today. It's a 4-week program. You're off on the weekends.
It helps you realize that you have the ability to heal or tuck that pain away, and with exercise your body creates your own medicine, which we learned that, which I didn't know that. And so with exercise you're creating the medicine that they can't recreate for you.
I have seen him take control of his life, take control of his pain. He was given tools and strategies to deal with his pain in a way that he doesn't really need the pain meds anymore.
It's the best thing I've ever done in my life. I'm so happy, and I feel fantastic now. I feel like I could do anything I want to. It's just I have to pace it, which is what they taught us.
Well, I got my life back, which is very important for me.
As he said, by far exceeded our expectations. I don't think he experiences anywhere near the level of pain that he had before, because when it starts coming on, he knows what to do about it.
I love golf and wanted to play golf again, and I am golfing again, and walking, taking walks outside with my daughter. You get to have your life back and see it in a different way.
Get in here now. I mean, this is the best thing next to having kids, and I joked with my wife, maybe even marriage, that I've ever done.
Anybody's questioning whether this works, try it. Try it, because it does.
Try it. You know, the first few days are the hardest, but if you try it and stick with it for the first week, you will want to come back, and you'll keep coming back because you want to, because you start feeling better.
This is one of the greatest staffs I've ever worked with, and if you have any kind of problem, they're always, every single one of them will talk to you, and they all have a little bit of different niche, and it's so much fun, and even though it's tough, they seem to try to make it fun for you.
The staff here are fantastic. Every single one is so fantastic. I think our PT Joe is absolutely amazing. He found stuff with me that I didn't even know was wrong on exams. So.
My husband says, hey, you want to golf today? And I say, yeah, let's go. I'll go as far as I can now. Instead of saying no. I wouldn't try it because I was in this circle of pain and I didn't know how to get out of it.
The Nebraska Medical Center's pain management program has been serving patients for over 40 years. In fact, we're one of the longest running pain management programs in the country. The program is designed for patients with chronic pain, meaning pain lasting at least 6 months, often much longer. And for most of our patients, they report that the pain has interfered with a variety of daily life functions. So many patients have trouble working, patients have trouble doing housework, difficulty walking for more than a few minutes at a time, difficulty socializing. And all of these challenges cause significant impact on family life and on their sense of well-being. What makes the pain management program different is that patients are with us for 4 weeks, Monday through Friday, 8 a.m. to 4:30 p.m. And during this time, they work closely with our physical therapists, our psychologists, our nurse and medical director to develop an individualized treatment plan. And the objectives of the treatment plan broadly are first to regain physical functioning, secondly to learn a variety of coping strategies and techniques for managing pain, and thirdly to evaluate their medications, possibly including tapering medications that are no longer helpful. Our core team includes physical therapists, psychologists, a nurse, and a physician. The physical therapists help patients regain physical functioning by working on flexibility, strength, endurance, and coordination.
When a person's dealing with a chronic pain condition, I think that it's very common that people begin to move less and less, because the common wisdom is that if something hurts, you need to rest, or if it hurts, don't do it. And so we've all grown up hearing this and benefiting from this at different times in our lives. So as people are dealing with a pain condition that doesn't go away, they become less active over time. And then they start to fear doing the movements that cause the pain. And so pretty soon this cycle is, spiraling down to the point where there's very little that they can do that's still comfortable, and they're not certain, how they need to get back into activity, if they should, if it's safe. And so one of the biggest things that we do in the physical therapy program is really help people to recondition their bodies. So we start down at extremely low levels of activity, sometimes just a couple of minutes of walking. 2, 3, 4 minutes of walking, and we gradually step them up, a minute here and a minute there, until by the end of the 4 weeks they're doing a variety of different endurance exercises, and they're tolerating it better than they ever have before, because we did it very gradually and we kind of came in underneath that pain experience in a way that they could start exercising and not flare up their pain. Another component of the program is the flexibility exercise. So we're doing whole body flexibility with patients, but we're just doing basic stretching, and not just for the areas they hurt, but for all over. Because most patients will tell you that even if it was their back that started the pain condition, that pretty soon they start to feel uncomfortable in other places as well, because they're just not doing the same things they used to. After the patients leave the program, they are able to come back for free for 3 months and sit through any of the groups that we do, the educational groups, the morning exercise sessions, the aquatics. They can come use our equipment for free for 3 months. And so we have patients that come in and use this kind of as a bridge to independent exercise. They like the camaraderie, the support from their peers, but they know that eventually they want to make that transition, or they need to exercising on their own. So they're free to come back and join us and sit through any of the groups they want to.
The psychologists work with patients on the whole range of psychological and social issues that are caused by pain, but also that have an impact on the experience of pain. For example, we know for many of our patients, when they're experiencing high levels of stress, their pain is worse. So the psychologists work with patients on techniques such as relaxation, stress management, interpersonal communication, how to get a good night's sleep, and healthy thinking. Also, the psychologist will meet with a family member of each patient at some point in the program to teach the family member how best to support the patient in the progress that they're making while they're with us in the program.
Our program census is usually anywhere from 5 to 8 patients at a time. And so patients really get a lot of individual instruction from the treatment team members, like in group exercise sessions. At most, I've got 4 people in a group that I'm leading. Imagine being in an exercise class and being only one of 4. You get so much one-on-one feedback from the therapist as you're exercising, yet you're not the only one doing this. So you're in a peer group with people going through the same experience, but you're getting this attention from the staff. Patients are getting 2 individual counseling or psychology sessions a week. They're getting 2 to 3 individual physical therapy treatments a week, which is actually much higher in frequency than most patients would get if they were receiving PT or psychology on its own outside of the program. The reason that we have 8 to 4:30 Monday through Friday for 4 weeks straight is because it takes that amount of time to really physically reactivate a person to be able to start very low and gradually work up. And we provide a tremendous amount of education during that time. And the benefit of that everyday structure too is that for most patients, they may have a couple good days, but then they have a really bad day. And that's the day that they don't function well, or the 2 or 3 days they don't function well. And so if they're here with us every day, going through the motions, learning how to cope with pain on a really challenging day, they get more out of that than having 2 weeks straight of good days. So they learn more on a really tough day with us than they would anyplace else.
Our outcomes are excellent. When patients come see us, we measure their level of pain. We measure the degree to which the pain interferes with their daily functioning. And we also measure their level of depression. And we take these measurements just as they're beginning the program, and then again as they complete the program. And our data show us that on average, patients' ratings of their pain decrease by over 1/3 from the beginning to the end of the program. Their ratings of the degree to which the pain interferes with their day-to-day lives decreases by over 1/3. And the ratings of depression, on average, decrease by more than 50%.
And as a staff, I think that we work together tremendously well for the benefit of the patient. And I've worked in a lot of different areas of physical therapy in the hospital, and I can honestly say that this multidisciplinary approach is just one of the best atmospheres for patients who have a complex condition, because every day I have the opportunity to interact with their psychologist, who's just right next door down the hall, and I can say, listen, this is the problem that we're having. Do you have any insights? And they might give me some tips about, their learning style is this, or they interact better if you instruct like this. And so I can apply that immediately to working with a patient and give that patient an experience that is a lot more meaningful and helps them to move forward faster.
We have a nurse and a medical director, and their job is to evaluate each patient's medication. And in some cases that means tapering opiate painkillers.
Narcotics especially were never intended for long-term use. They were intended to get you over the hump initially of a surgery or an injury or something like that. But once you start healing and going through the healing process, then your doctor should be taking you off of those narcotics and maybe using something like over-the-counter, like ibuprofen or Tylenol or Aleve. We, hope to get people off of medications, especially narcotics, because when they take them, sometimes there's a phenomenon called hyperalgesia, opioid-induced hyperalgesia, which is increased pain caused by the narcotics and the metabolites from the narcotics. And so if we can, get people tapered off of the medications, generally some of those pains will go away. And people are, as a general rule, surprised when they come off of the medications that their pain is actually better.
A question we get all the time is, will insurance actually pay for this? And the answer in the vast majority of cases is yes. We have a dedicated admissions coordinator who works with patients and their insurance companies to verify benefits and secure any needed authorizations. We have patients come see us from all over Nebraska and sometimes Iowa, South Dakota. So patients will often travel hours to see us, and for those patients, we're able to provide housing for them right here on campus at no charge to the patient. Physicians can refer patients to the program, or patients can refer themselves. And in all cases, we'll do an evaluation to determine if the program is a good fit for the patient. And all patients will work with our admissions coordinator, who will get everything scheduled with the patients, who will check their insurance and answer any questions they have along the way.